Hello.
Good afternoon, ladies and gentlemen. We'd like to welcome you to the Healthy Flint Research Coordinating Center's Flint Community Webinar on Coronavirus. How many of you can believe it is now 27 weeks? I was reflecting as we were talking with our partners a few moments ago, just before starting the webinar, that 6 months ago, our governor declared a state of emergency as a result of the coronavirus pandemic. Our offices were closed, our schools were closed, restaurants were closed, and the Healthy Flint Research Coordinating Center and its partnership with community members and academic partners in planning for an annual symposium, were faced with a decision. We could not gather 250 or so people in a room anymore. So what would we do, and how could we be relevant in this situation? And so 27 weeks ago on a Monday, we started the conversation and held our first webinar on Friday, March the 20th. And so today, we're excited that even though we're in the midst of this difficult time, we have had a number of partners in our community who have agreed to join us to work on addressing the issues that we're facing. Because we must remember that we were facing some really difficult issues prior to Corona. We had a water crisis. We had other economic and social issues that we were dealing with right here in the city of Flint, Genesee County. And these partners had worked together before, but to come together on this issue was very, very important. And so I want to just, as you look, and for those of you that have joined us by webinar, and maybe you join us by YouTube, you can see the banner of organizations. And I just want to point out that at the core of this, or at the foundation of this, are the partners who have been consistent in making sure that this information comes to you. I'm a little bit backwards: Michigan State University, University of Michigan Flint, University of Michigan, Ann Arbor, the National Center for African American Health Consciousness, community-based organizations, Community Ethics Review Board, and a number of other community partners have helped us to work through ensuring that we can bring relevant and important up-to-date information for you. We were concerned about what would happen with our schools. We were concerned about what would happen with the health. How do we get to the doctor, and how do we get to the hospital? And so we appreciate each one of these partners that have joined us. And most importantly, we appreciate you who join us every Friday to get this information and share it with other members in our community. For those of you that are joining us by phone, you can't see all of the information that's in the webinar, but we want to encourage you, when you have opportunity, to go on and like us and join us, subscribe to our YouTube channel. But you can go just Google the Flint Coronavirus Community Webinars, and you can view those YouTube examples from our previous webinars. And if you want to have a question answered today, you can call us at 810-835-2130. Again, that number is 835-2130, and your questions will be answered or made available for us to answer. For those of you that are in the webinar, please be sure to put your questions in the Q&A, and our partners here will be ready to answer those questions for you. Today, we're going to focus in again on Flint Community Schools. We're going to hear more about what's happening in the city of Flint. We'll give you an update on our testing sites and the work of the Genesee County Health Department. And we want to just take a couple steps back today and remind us some of the very important things that we started off with, understanding the coronavirus, keeping in mind we don't know it all and we're yet learning. So today we want to again begin our conversation with our City of Flint. Dr. Lawrence Reynolds is the Chief Health Advisor for the City of Flint, and he also has some assistance with him today. But Dr. Reynolds, we're going to ask you to open up today and invite Billy Mitchell to share with us as well.
All right. In case you fall asleep, today is the last day to get your lead service line replaced. And you see the numbers on our PowerPoint. Please call if you have any question, if you're not sure. Remember, we are in the middle of a pandemic. Govern your behavior accordingly. So that means before you go to a wedding, funeral, or even an informal gathering, make a plan, wear your mask, decide if it's worth the risk, And people should understand that if you have any conditions or age that make you not want to go, or if you have people in your house with any go.
We lose Dr.
So
Reynolds. Lost you for a minute, Dr. Reynolds.
then switch over to Billy.
All right. Billy, can you share with us?
Yeah, so like he was saying, today is the last day to opt in to have your pipes replaced. People can again email me at B as in boy Mitchell, MITCHELL, at cityofflint.com. They can email me their opt-in forms, or they can come here to the City of Flint at City Hall, 1101 South Saginaw Street, and they can fill out those opt-in forms in person. We're not open to the public, but we are allowing people to come until 4 p.m. to get their forms. And I am taking those forms myself down the street to Row to make sure that they receive those opt-in forms. I can also be reached at 237-2044 for any questions. I did want to talk a little bit about the clerk's office hours. A lot of people don't know that she opened up her office on Monday. So you can go to the clerk's office from 8 a.m. to 5 p.m. Monday through Friday, and you can do your absentee ballots there. Right now, she is doing applications for ballots. She doesn't have the ballots themselves in her office, but she's expecting them any day now. Some special dates to remember are Saturday and Sunday, October 17th and 18th. The clerk's office will be open on that Saturday and Sunday. Also, Saturday, October 24th from 9 to 5. 9 to 5, those other 2 days also. And then Saturday and Sunday, October 31st. And then November 1st from 9 to 5 also. The deadline for absentee ballots is Friday, October 30th at 5 p.m. And also people can register for an election and immediately obtain an absentee voter ballot during the 14 days leading up to an election on election day. Voters who register to vote or update their address on election day may vote by absentee in the clerk's office only. So I did want people to know they can go ahead and start coming into City Hall to go ahead and get their apps in for absentee, because like I said, a lot of people are not aware that she's open right now. So.
Thank you, Billy. Can I just ask you one question that came forward? If a person called the number and they didn't actually fill out a form, do they have to fill out a form in order to have Row come out?
They do.
Okay, so if they weren't advised of that and they already called in and they can't get that by 4 o'clock, what are their options?
They can download the form and email it to me. There's a signature portion on the form. I don't know if you can see it, it's probably backwards, but there's a signature portion that we do have to have to be able to have permission to go on someone's property and start digging their yard. So they can download it, they can email it to me. If they can't make it by tell them to give me a call. There's a couple of homes I'm visiting today, so I can visit theirs too.
Okay, so one other question, Billy, is that form on the city's website, and that's where they should go? Okay.
Mm-hmm. Yep.
All right. Thank you. Dr. Reynolds, did you have anything you'd like to add to that?
No, my public health manager has made everything perfectly clear. Address this today.
Thank you, Dr. Reynolds. I mean, today, 24 hours, we still have to midnight tonight to get that email to you? Billy?
You won't let Billy walk down the street to Row after dark.
Yeah, well, they close at 5, so I can physically drop it off by 5, but they can still email it to the email address on the website, not to me, because I'm printing them off and taking them. So use the email address on the website if you need to email after hours.
Okay, just so people are aware that option is available for them should they not be able to get off work by 4 o'clock today. Thank you so much, Billy. And while go ahead, yes.
No, I was just saying you're welcome.
Okay, you're welcome. Now you mentioned that Dr. Reynolds just said today, so we have another 2 day. It's Tony Tony is on with us today, Tony Turner, and he is, as you can see, Tony has been the guru of the census. He has been very diligent about making sure that we get the census information out. And we're counting down for the census too. We only have a few days left. We're down to a few hours with the pipe replacement program, but only 13 days now to complete the census. So Tony, bring us up to speed. I think you have some good news you want to share with us today.
Yeah. But good morning to everyone. I hope this meeting greets all y'all in great health and spirits. Before I give the good news, which I think is really outstanding, I would like to say to everyone, thank you for the partnership. We all work together on a very committed basis, and we could not have attained a victory for Flint in the 2020 census if there was not such a thing as partnering and coordinating between all the partners. And it was not a one-man show. When I stepped on the scene to humbly serve my city, I knew it would be a hard task, but I knew it would be made easy by the cooperation of all our partners. I want to give a big thank you and a shout out to the Community Foundation, Stephanie, Sue Peters, Mr. Oliver, all the M&A grantees, everybody that was involved, putting boots on the ground to make this effort what it is today. And it could not have been done by any one of us singularly, but it was a team effort. And, you know, team makes the dream work. So a dream without team is a failure. So I appreciate everybody from the bottom of my heart. So the good news that I'm leading into is unprecedented because, as many of you know, I retired from the Census Bureau. My last position was as a senior partnership specialist in my last 10 years of service from 96 to 2013 with the Bureau. And when what I see today, I have not seen in the previous 2000 or the 2010 census. And that is our total response rate as it stands right now. As of today, we thought, we struggled, we fought, we were dismayed, we were frustrated. It was like, these numbers aren't moving, why aren't the people responding? But as of today, our NARFU total response rate workload completion for our area is now at 90.4%. That's 90.4%. That's unprecedented. And that goes to the hard work and the final push that we're putting on, because before we started the final push a couple months ago, I in my daily talks with the U.S. Census Bureau Regional, they were having a hard time here because people really didn't know a lot about the census. And that was really due to not the grantees and all of us on the ground weren't doing our job, but COVID really inhibited our ability to reach out and personally touch folk and educate and advocate for the census. But once we started putting more events together, started reaching out at the coordinated level of census tracts and wards, people started hearing the message and began to understand, and the Census Bureau began to let me know that their enumerators, which are on the ground, are having such a better time at getting doors open and people responding. So this is a testament to all the efforts that we have put in. So to kind of put this into a parameter that we can understand, when Mayor Neely asked me to represent the city, I had to put together a plan. Now, many of you didn't see the plan, but we put together quite a comprehensive outreach plan because we knew that moving into this census, we were confronted with a lot of barriers that we weren't confronted with in 2010 and 2000. And we wanted to have a clear path to address those barriers and make sure that we attain the goal. So we set a goal of 82%. And some people are like, wow, I don't know we can make that in this area, but we were quite confident, the team was quite confident, and we struck out to meet that 82% goal. So today, we've exceeded that by 8.2%. And if some of you remember, in 2010, we had a closeout of 79%, and we've exceeded that by 11% as of today. So when I look at our numbers compared to other like cities, like Detroit, for instance, Detroit is still struggling. They're down below 70%. However, we moved our barometer through hard work, commitment, and engaging our residents where they are at and where we're at today. So again, great work. One thing I want to clarify, and I did send an email out, but I want to share this with everyone. When this started, and even now, yet hear people say, we got to have 100,000 or we lose. We got to have 100,000 people or we lose. Well, we haven't had 100,000 folks since the 2010 census, and we've had some crisis since then. So that means we had exodus of folk. So when the 2020 census started, the city of Flint, we didn't have 100,000 people. So I wanted to clear that up right now, because a lot of people, I don't want the workers or anyone to feel like their work was in dismay because we didn't get 100,000 folk. But if there is 100,000 folk, we will get it. But I want everybody to know that at the start, as of June the 1st, 2019, the city of Flint only had 95,538 folk. And that was according to our ACS census data, which is American Community Survey, which was actually the long form that was done every 10 years, and now it's done every year. So just starting out, we want to clear it up that at the beginning, when this all started, Flint didn't have 100,000 people. The best we had was the population estimate of 95,000. And according to those estimates, those numbers are yet falling. And also, we hear the term Tier 1 city. Flint is not a true Tier 1. It's a Tier 1 by legislative designation. A true Tier 1 city has to have one of the qualifiers is 300,000 folks. So when you hear Tier 1, because the city of Flint is the hometown of the automobile industry, and a lot of manufacturing and innovative things happen here in Flint, it was put in place by former Representative Dale Kildee, and we received a designation of Tier 1. So I just wanted to clear it up, because a Tier 1 city has a highly developed and established real estate market. Tier 1 cities are highly developed with desirable schools, facilities, and businesses, and their real estate is very expensive. Plus, they have a population over 100,000 folk. And then you have Tier 2 and Tier 3 cities where those markers come down more and more. So I wanted to clear it up so that as we see the numbers and as the numbers come in, we don't want anyone to be gauging it at 2010 census numbers, which are not evident today. So that being said, the good news is that our hard work has paid off. We could kind of sigh a little bit, but we can't exhale, because we now have about 10% of the population left. These are the people that are truly trying to avoid us. They don't want to be found. They don't vote. So this is where all the work is really going to come down to making sure that we can find those folk and get them signed up. And right now, today, last week, I started partnering with a lot of our bigger partners. Like today, we have the Michigan Department of Health and Human Services. They're over in Evergreen Regencies. So what we're doing now, we're targeting the multifamily housing complexes, which are yet dragging a little bit. So these are things that we're doing to make sure that this last 10%, we obtain it. And again, thank you to everyone. We're now at 90.4%.
Thank you, Tony. Thank you, Tony. And you mentioned some other events going on. We just want to mention one other event. You've got something going on at a housing complex, but we also want to mention that there is another community event that will happen tomorrow at Faith Foundations and in partnership with the Flint Fire Department. If you are in need of getting that census filled out, meet them tomorrow at between 3 and 5 p.m. at the Kennedy Center, located at 1678 West Pearson Road. There are a number of events that are coming up, and we're going to talk about another where you have opportunity to have your census completed today. So thank you so much, Tony, for that update, and we want to give everyone a round of applause and say thank you, but we've got a little ways to go, and we can make that happen. I do have a quick question that we want to get answered, and then we're going to hear from our Assistant Superintendent of Schools. So please put your questions in the queue. This is back to you, Billy. You mentioned that the clerk's office would be open, and I mentioned last week that beginning September 21st, we can start with the early voting. One of the questions is, when will poll watchers be trained? Do we have that update yet?
I'm looking at the press release from the clerk's office, and I don't see anything about training for poll workers. I can get the answer though. I'll try to get it now. I'll go back out on mute And then I'll,
Thank you. And we'll look forward to getting that. If you have it today, we would appreciate it. But not, we'll be back next week and we'll talk more about that, because that is continuing to talk about being ready to vote. Plan your vote and vote your plan is something we'll have as a continual part of our conversation for the next few weeks. As I mentioned earlier, we're concerned about the school reopening. We're excited today to have the assistant superintendent. And I'm sorry, brother, because I knew you were a principal for so long. He is now the assistant superintendent for the Flint Community Schools. Brother Kevin Jones II, please share with us, give us some updates about how we can interact as parents and grandparents for our children.
Hello, everyone. I'm glad to be here today. It's good to see you, Yvonne. As always, looking so elegant. Good to see you.
Thank you. You're gonna make me smile now.
There is so much going on. And your question is, how can grandparents and parents help? First of all, we would like to thank all of our parents and grandparents for being teachers. Right now is an unprecedented time. Things are different. Not having our scholars face-to-face in school is not the ideal way to teach. We're seeing that our families are struggling there, and we want to ensure that our scholars are being educated, motivated, and inspired. But we do understand safety comes first, and as we know that we are still seeing COVID cases rise, we do not want to put our scholars nor our staff in danger at this time. And so in an effort to continue to educate, we are doing distance learning classes, and our scholars are online for 3 hours a day. We are also providing intervention during the other hours of the day for one-on-one, those scholars that need more help and more assistance, and for families, for parents who need some one-on-one time with our teachers, just to know how to use the systems, know how to understand the way the curriculum is being taught and the instruction. It is different now. The way I was taught math is different than the way we're teaching math now. Teachers used to want to know the answer. Now they want to know how you're getting to the answer. And so a lot of our parents come from my school or beyond that, and it's a different way of learning now. And so we have parent universities that our parent facilitators are doing for our parents, where they can get on a Zoom and learn how to use some of the tools that we have out for our scholars. We are doing one-on-ones, as I said before, with parents. And anytime that we, as the central office, need to meet with parents, we're doing that as well. We're on our second wave of getting out on the streets to find those scholars that have not shown up. As you know, last month, we put our feet to the pavement, and we were out going to find our scholars. We were down about 1,800, and now we have shortened that number to about 400 scholars. And so we're going out to do a second wave, feet to pavement, return to learn, and we're just going from there. We're doing everything we can to get our scholars in front of their teachers.
All right, so thank you for that. Just a couple of quick questions.
Sure.
Every school has a little bit different process. So do the parents, should they call directly to their school, or should they call the central office?
Parents, everything is as normal as it pertains to contacting teachers, contacting their principals, and contacting the central office. So parents should be contacting their schools during their school hours. And their principals and secretaries will get messages to teachers. Teachers have put their emails out. Most teachers have even put their own numbers out there so that families can contact them. So yes, as you would normally contact, please use those same methods as you used last year when we were in school.
So another question, are the parent universities offered in different languages?
That's a very good question. We do have ELL staff. We do have ELL staff, and when that pops up, we do refer them to our ELL staff. I know of one situation where that did pop up, and we were asked, actually at Doyle Ryder, we had some scholars that are ELL students. And when that pops up, we do offer our ELL staff to assist in that area, yes.
Okay, so if we're encouraging parents, and please be in touch with your teachers and the staff at the school. Now, what if I'm working and I can't get to the daytime parent university?
That's when, and that's an unfortunate situation, but what we do is we schedule the one-on-ones. And I guess some of the issue that we face is being able to communicate with having the two-way communication going on. We are definitely here, and we are reaching out to our families, and we want our families to know, if you're listening, please reach back out to us. Let us know what your concerns are. We have an email. You can email superintendent@flintschools.org. Again, superintendent@flintschools.org. That is a direct email to myself and Miss Anita Stewart, who is our superintendent. And we are answering questions. We are setting up meetings. Whatever our families are asking for, we are trying to contact them. And so, yes, whatever we can do, we're doing.
Assistant Superintendent Jones, I had to say that so I can get it right. We appreciate you and the information that you share. We know that this is a daunting time for all of us. And I want you to know that on our webinar every week, we have a tremendous number of community health workers who are working in the schools. And so your appeal to them as to the way they can best support is to encourage the families to call in. And then, okay. So
Absolutely. Because if they're calling in, we're reaching out. We have wellness teams, and this is something that people should know. We have wellness teams, our behavior specialists, our social workers, our clinical therapists, our nurses. They're calling families every week. When there's a scholar that is not showing up to class, whether it's a technical issue or whether it's just they're not showing up, our wellness teams are on the phone every day trying to figure out what is it going to take to get our scholars on. And also social emotional needs that need to be met. We are constantly talking to our social workers about making sure they're meeting those needs. Families are still coming in. We're giving out more devices. We're giving out more hotspots. We're finding that some of our families do not know how to use those computers. And so Parent University is assisting there as well in those one-on-one meetings. So if you have families that are working first shift, please make sure you call or call your child's school, and they will set up an appointment with the parent facilitator or even the principal to ensure that you get your needs met.
Thank you, Assistant Superintendent Jones. We are appreciative of your time. We know it's a busy time for you, but we want to make sure that our parents and our community members know that you're reachable. And so again, appreciate you. And we know that in the future, if we need you, we can call on you and you'll be here.
Absolutely. kjones@flintschools.org. You can reach me at that email address.
All right, so you got it. We'll look forward to talking with you.
All right.
As we think about the things that are happening in our schools, we know that the COVID testing and immunizations are critically important, and that's an ongoing conversation. Our Genesee County Health Department is here. Suzanne Cooper was going to give us an update of overall for the health department, and then she's going to focus in on the testing sites. Suzanne.
Hi, everyone. So as of yesterday, we posted to our website 3,444 positive COVID-19 test results and 281 deaths with a 2.1 positivity rate. This is the time of year we want to encourage everyone to get a flu shot. So we've been encouraging everyone all summer to get up to date on all your other immunizations so that you would be ready for this time frame. Recognize we're going to have 2 respiratory illnesses, COVID-19 and influenza, and it is truly important that everyone this year particularly get a flu shot. And there will be multiple opportunities for getting a flu shot in our community. Our pharmacies currently have them. Many of our partners, our federally qualified health centers and physicians' offices are getting the flu vaccine in as we speak. So we strongly encourage everyone to seek out that opportunity. Yvonne will tell you a little bit about an opportunity that's happening today that we hope that you will take advantage of. I know I will be doing that, and I'll hopefully see some of you there this afternoon. But this is the time where we want you to get a flu shot. Again, we want you to be able to take good care of your health, make sure you're getting rest, taking care of your physical and your mental health, making sure that you're up to date on all of your health screenings. We hope that you have a medical home, a place, a regular source of medical care, so that you have someone to help guide you through this process. And again, remind everyone about the testing process. So we're going to talk a little bit about the testing sites, but I also want to remind you about contact tracing. So we have 3 new community testing sites in Genesee County: Word of Life, Bethel United Methodist Church, and Macedonia Baptist Church. All of these locations are seeing both adults and children for testing. So we encourage you to use them, come to the testing sites. We encourage appointments, but they will accommodate anyone who comes. They are also making sure that there's language translation available for anyone who has English as a second language, or someone who might be from the deaf and hard of hearing community that uses American Sign Language. All of these locations have been visited to make sure that they're ADA accessible. So want to make sure that you're aware of them, and remember that they are using the saliva test. So we don't want you to eat, drink, chew gum, use tobacco products, or anything like that 30 minutes prior to your visit. So want to make sure that everyone's aware of that and that they take advantage of these sites. We also still have other partners who are offering testing in our community. We have the Rite Aid Pharmacy in Swartz Creek and the one that is in the city of Flint on Clio Road. We have the Walmart Supercenter that is on Corona Road in Flint Township. And we also have our partners at Hamilton Community Health Network Clinic. They have a clinic at North Point and the fire station that is at the corner of Bristol and South Saginaw. Just a reminder to everyone that when you get a COVID-19 test, should you test positive, you will get a call from the health department asking you to identify those that you might have been with or around during the time frame that you are contagious, so that they can be reached out to, provided guidance and education about protecting their health as well. So if you get that call, please take it. Please share all the information that you can about those people that you might have been around and potentially exposed them to COVID-19, so that the health department staff can reach out to them and make sure they have all the information that they need in order to keep themselves safe as well. We, again, remind you this is the best time of year to get your flu shot. We encourage everyone to get one this year. And certainly your local pharmacist or your physician can help guide you to which flu shot is the appropriate one for you. And if there are any questions, don't ever hesitate to reach out to the health department. We're here to answer your questions. I will remind you that we are open at our Burton Health Clinic for our clinical services. We do our WIC program, family planning, immunizations, and sexually transmitted infection testing. And if you come to our clinic, you will be asked some questions for screening, and you will have your temperature taken. We want to ensure that you're wearing a mask and appropriately social distancing. We want to keep everyone safe while they're in our clinics.
Thank you, Suzanne. A lot of good information. I hope we're paying attention to these testing sites. And you mentioned the flu vaccination. So today, we talked about this last week as we were talking about immunizations. There's been a campaign for a number of years we call Be Wise, Immunize. And we started this work trying to reduce the myths about the influenza vaccination and encourage people to get their vaccinations, because we always talk about these disparities. There's a difference in the number of people in our African American and Latino Hispanic communities who are getting immunized for the flu. And we were seeing poor outcomes. So today I see Jim Melanowski is on the line. I'm going to ask him to come on and talk a little bit about this event that's happening today at the Genesee Health Plan.
Thank you, Yvonne. I'm excited. I'm going to see Suzanne this afternoon. Why don't more of you come and get your flu shot? This is a wonderful opportunity. We've been doing this for 7 years. We've been doing this drive-through concept before it really became popular over the last year in response to COVID-19. So our partner in this is Walgreens. They're supplying the vaccine, the flu shot, and their pharmacists will be the ones who administer it. And really just encourage you or others to come between 3 and 6 p.m. and get your flu shot. Even children ages 4 and older can get their flu shot as well during this. There's going to be health screenings for women ages 40 to 64. And Tony, we're doing census. We have enumerators that are going to be there for people who have not completed their census yet. And the census folks have also been gracious enough to give us ice cream that we can pass out. But you must get a flu shot in order to get ice cream. That's our big rule on hand there. So we'd just love to have everybody there, 3 to 6. Very easy. Try to decrease any access or barriers. People don't have to get out of their cars. So it should be a safe COVID-19 type of following those guidelines to be able to get this done.
Thank you, Jim. And again, as Jim mentioned, there are a number of other services that we're providing today, because as much as possible, and I think, Suzanne, you mentioned this as well, as an overall community, you know, the number of partners that are working together to ensure we reduce all possible barriers so that persons can get the services they need so that we can have a healthier community. So we look forward to seeing all of you who have not got your flu shot. Come join us today. And we'll be sure to take good care of you. Now, a few weeks ago, we started this out. Oh, someone asked a question. Do you need to bring your insurance card? That's a very, very good question. If you have it, yes, bring it. That would be helpful. There is no out-of-pocket cost for today's immunizations. Most insurances are covering this vaccination. So please make sure that you understand that. Bring that insurance if you have it. There is no identification required, that, you know, so that we are wanting to make sure that there are absolutely no barriers, but we do want you to show up, and let's allow us to provide that assistance for you today. Thank you for that question. So a few weeks ago when we started this, we gave some real detailed information about the coronavirus, as much as we knew at the time. And we've tried to provide some updates. Today, Dr. Deborah Verholden is going to give us some she's our epidemiologist extraordinaire. She likes to dig into the numbers. And so she's going to help us understand a little bit more about what's happening, the landscape here in Flint in Genesee County.
Oh, thanks, Yvonne. I'm in a new setting. I'm at my son's apartment today. I want to give a shout out to my son, Gabriel Holden, who turned 21 yesterday, and he's now officially a Flint kid and finishing up at Mott Community College. I want to just give a quick overview. So the first thing is that we all know that the daily lives of people in Michigan have been impacted significantly by COVID-19 epidemic, but also we have been impacted by the mitigation response that's been mounted both by the state and within the counties and in the city of Flint. The background, racial ethnic minorities have had a disparate level of impact. They have a much higher risk of exposure mostly we think attributable to employment and residential inequities, more likely to be exposed in the course of their work, and then also at home because in large part, some of the correlation with employment exposure. We had higher rates of infection and higher rates of severe outcomes during the epidemic, whether they be bad outcomes that didn't result in death or higher rates of death. And we also had lower levels of healthcare utilization and preventive screening. I don't think that that is fully attributable to our own decisions, but we learned a lot about the system of care and how some of the barriers that were in place marginalized socially vulnerable populations as well as racial ethnic minorities. So we all agree, I think that it's crucial that the health equity lens and that approach be taken to this pandemic response and recovery. I'm gonna just share a little bit of the data that's been provided to me. This came from our wonderful Bureau Director, Dr. Sarah Lynn Callow, who is the Bureau Chief of Epi and Population Health at the Michigan Department of Health and Human Services. So the first thing is, if we go back and we look at where we started off, yeah, a lot of us heard these various numbers, but if you look right now where we are, and these are updated as of September 7th, this was a presentation that Dr. Callow gave for the Michigan Health Policy Alliance. I will throw the link up in the chat so that others can see it. There's a lot of good information that's there and that was presented about understanding the spread in the city. So Black African Americans make up, we were using the number 14%, but it's over 14%, so it's rounded up to 15%. And to date, they've been 31.2% of all the cases in Michigan. Additionally, our Hispanic and Latinx community is about 5.3% of the Michigan population, but they reflect in total 10.7% of all the cases. The thing I want to highlight there is you can see there's a doubling effect. So we're 15% of the population, but more than 30% of the cases. Similarly, 5% of the population for Hispanic Latinx and more than double, 10.7% of the cases. If we break that down, however, and start to look at what the more recent trends have been, and I'm gonna next just point to what we've learned from examining shorter time periods. If we go to the next slide. So go back, 31.2% of the cases, 15% of the population. If you look at the moving averages over the past 2 weeks, and we also have this data broken out where we've been looking at it over several periods. African Americans now only represent 9.1% of the current cases. So we're actually now underrepresented in COVID cases. And I think in large part that's attributable to the work that's been done to deal with some of those barriers to testing. When testing originally came out, you needed a primary care script, you needed an ID, we didn't have community testing sites, et cetera. And I think getting rid of a lot of those barriers is what's attributable to the reduction that we've seen. So as far as caseness goes, we've seen basically an elimination of the disparity between African Americans and whites. However, in Hispanic and Latinx populations, you can see we've made some progress, but the progress is not equivalent progress. So earlier in the pandemic, and if you look at the total rate, the total case rate, they are about 5.3% of the population, but represented 10.7% of cases. We have narrowed that some, but not nearly as well as we've done with addressing the African American population. And now in total, Hispanics represent 9.2% of the cases. I think there's again, we got to keep doing the work. As a part of the governor's state task force, we've been looking at what are the barriers, what are the levers that we need to pull so that there's equity in access to testing and then the support services and the therapeutic services that people need once they've been identified as a case. It looks like we've done a better job of that with Blacks and African Americans than we have in the Hispanic and the Latino population. If you can go to the next slide. So looking at these rates over time, and these are by week. Again, you can see earlier in the pandemic on that top graph where it says by race category, you can see the top line, the gray line represents Black and African American. And we started off in early March and had this rapid acceleration of our curve. We started to identify what some of those barriers were, started to implement the kind of equity measures that we need to level the playing field and help flatten the curve in that population. And if you look now by race, you can see as of week ending 9/6, we basically have all converged and you get sort of equivalent. And these are rates. And I want to distinguish between rates and total numbers. The rates is the percentage within that population based on how many people are in that population. So this is really an apples to apples comparison. And you can see we've had a convergence. So we've narrowed that disparity. Look earlier in March and April, big, huge difference. As we get further out now and over the last several months, we've seen a significant narrowing of that disparities. So while we have African Americans experience a higher burden of COVID-19 compared to other groups, we've now started to come together and the case rate is much lower and equivalent for African Americans and other racial groups. When you look by ethnicity, again, you can see the purple line represents Hispanics. They started off kind of low. The acceleration in that group was a little delayed, further behind African Americans. I think a part of that is due to testing. Cases are only a function of testing. So we can only identify cases among people who've been tested. And I think as we improve testing in that population and dealt with some of the barriers related to access, language, transportation, fear of being involved in the system, et cetera, we got an increase. But then if you look over time, we still have not sufficiently narrowed the disparity in that population. So they still do face a higher burden related to COVID-19. So that's just a snapshot on what it looks like for cases. It looks like not only have we moved in the right direction in a big way, in some respects, we've actually dealt with the disparity. All right, so as it relates to death, again, all of these data and these summaries have been provided by Dr. Lynn Callow, Bureau Chief at the Michigan Department of Health and Human Services. What we see is, and if you'll go to the next slide, the number that we all heard that had our jaw drop. And again, I give an acknowledgement to the state of Michigan because Michigan was one of the first 3 states to even report out on the data by race and ethnicity. So we all heard the 1441 number. African Americans are a little over 14% of the population, but 41% of the deaths. If you look now, again, at the last 2 weeks of moving average, and again, we've done that over several 2-week periods. So this does reflect the trend that we've seen over the last several 2-week periods. We are still over 14%, so just around 15% of the population, but represent now actively about 12% of the active cases. So we've narrowed that disparity. If you look for, and this is death, okay? So we talked about the cases. We still have a case problem in the Hispanic Latinx community. We've eliminated that disparity in cases by race. You look here, Hispanics started off earlier in the epidemic at a much lower case rate. Again, I think a part of that is we weren't doing as good of a job identifying them as cases, so then they weren't then identified as deaths. And it looks to be that there's no disparity in death rates among the Hispanic and Latinx population. So we've made some progress and basically flattened out and leveled out disparities as it relates to COVID deaths, both by race and by ethnicity. So some of the take-home points and the takeaways that I kind of want to leave people with. Next slide, please. Oh, sorry, average daily new COVID deaths. Again, this just sort of exemplifies, you can see we start off really high, there's a big difference, and then over time and somewhere between July and August, we really started to ramp up on all of those implementation measures, and we've now flattened out those disparities. Next slide. So the bottom line is the racial disparities in COVID deaths that we saw early in the pandemic, we think were largely attributable to racial differences that we saw in the case rate. African Americans and Hispanics were overrepresented in the cases. They were then also overrepresented in the deaths. And some of those differences in the COVID case rate, again, we think are largely attributable to increased community and occupational exposure, as well as lower levels of healthcare utilization and preventive screening. And we think a lot of that is linked to systemic bias. It wasn't that people didn't want those services, but they were getting differential treatment and had barriers that were overrepresented for their community. And so we think that was linked to some systemic bias that we've dealt with. The racial disparities at the state level are narrowing and in some cases have even disappeared. It's important for us to evaluate the impact of our efforts and know what worked, what is working, and what's not working. We really are in a state where we don't have any resources or time and attention that we can be wasting. So there's clearly some things that we've done that are working well, and we need to make sure that those things stay in place so that we don't then, when we have potentially a second surge or a second wave of the epidemic, go back and experience what we experienced in the beginning of the pandemic. And I want to just acknowledge our wonderful state, county epidemiologist, Suzanne Kupel. All the getting the data and then being able to analyze it and give it to people in a way that lets them know what's happening in our community and how we're doing, and how specific segments of our community are doing. It's not a trivial thing. There are lots of protections in place that are designed to protect our community members, right? It is a private matter. Your COVID status, your health status, that is a very private matter, but we are navigating and working through the process of having a memorandum of understanding in place and a memorandum of agreement so that we can unpack our local data the same way and let our community know how we're doing. I surmise, based on the basic calculations that we've done, that we've also seen tremendous narrowing of the disparities in Flint and Genesee County. And I'm gonna just also give a shout out to Dr. Reynolds. One of the things that we also realize as we approach school reopening, we've gotta unpack this data and understand what community prevalence looks like in children. We wanna make sure that we don't, in school reopening, further exacerbate any racial or ethnic disparities or give way to them. And so that local county level analyses are forthcoming, and we've got great partners at the health department. And again, I just give a big acknowledgement to Suzanne Kupel, who I know has been fully activated during this pandemic and been a really great partner in helping us figure this stuff out.
Thank you, Dr. Deborah. Now, before we leave this point, I think you've made some really critical observations as it relates to these data that you showed us. And one big thing is prevention. And even though we don't have all of the data collected yet, but we do know that people are wearing masks. Yep. And we want to encourage that. That's coming up on our next slide. And then we're also thinking about the schools, and we want to appreciate them because they've delayed opening our schools because they recognize that there were some things that were not in place. So hopefully that will assist us in that way. So we want to encourage our participants on the webinar, please help us encourage our families to utilize the resources that are available to us. We mentioned the testing sites. We mentioned these opportunities to get flu vaccines in community settings. When we utilize these opportunities, we can improve our potential outcomes. So Dr. Deborah, just kind of hit on these things from your epidemiological mind and help us to know why these things are important.
Well, I'll give the I think the biggest bottom line, especially as it relates to our children. We all know that children do what they see, not what they're told. And I think many of us do that. So I think it's critical, especially as we approach school reopening, that parents and adults and community members model the behavior that we want to see in our children. And so if we want them to wear masks, you have to wear masks. If you want them to wear masks when they're in school, you've got to be wearing masks. They need to see you leave the house in a mask. They need to see you masking up when you're going in the store. They need to be masked up when they're going in the store. This is the time for us to model the behavior that we want to see sorry about that. This is the time for us to model the behavior that we want to see in our children. And whether or not people like it, wearing a mask and practicing good hand hygiene are probably the two most important things that we can do from a personal standpoint to model that behavior and also help to slow the spread of the disease. You all have already said it. We also are now going to be dealing with 2 respiratory infections happening at the same time, whole nother set of problems. So people doing everything they can to boost their immune systems, getting their vaccinations, making sure that they're adult and their child vaccinations are up to speed. All of these things are critical. And I know it's tough, but it really is important. If you've been out or if you've had people in your home, you've got to get tested. I haven't been tested in about probably 4 weeks. So it's time for me to get a test too, because even though I've been practicing the protocols, I have been out, I have potentially been exposed, and this is not the season where we want to operate in the dark. We want to know, and I know it's inconvenient, but I do encourage people. We've got these community testing sites which are underutilized. It's important that we maximize and capitalize on the resources that we have to keep ourselves and our community safe. And the last point that I'll touch on from here is it's really important to stay up with your ongoing medical care. Just because we're in a pandemic doesn't mean that the conditions you were dealing with before now are somehow less important. And we also know that we've got emerging health concerns. So I just encourage people to stay in touch with a primary care provider. We have Hamilton Community Health Network on all the time. We have a really fabulous, federally qualified health center. Some of the nicest people you'll ever meet if you pick up the phone and call them. They get people in. Make sure that you're maintaining both your physical as well as your mental and emotional health during this season. A lot of people may not realize, but when your social and emotional health is down, your immune system goes down with it. Happy people have stronger immune systems. People who are well have stronger immune systems. So I really encourage people to also stay on top of both their physical and mental and social well-being during the season.
Thank you. Thank you so much, Dr. Deborah. And I also want to point out while we're at this point that there are many advocates on these calls, on our webinars, in our meetings. Many of us are in multiple meetings, so we're seeing each other 2 and 3 times on these Zoom calls, advocating. So I want to give a shout out again to our community health workers, health navigators, and all of you that sit in these various meetings. It's because of your advocacy we have these testing sites. Your advocacy that has created the opportunity for us to have the additional opportunities for us to have access to these coverages. So continue to advocate. As we've advocated to get these opportunities, we need to now encourage our community members to utilize them because we don't want to lose them. Here's some ways that we can do this. We've talked about this over time. Dr. Deborah has just told us about being safe and following and honoring those protocols. We talked about the census today. Please complete the census because it is your voice, again, that will make the difference. And absolutely, absolutely, this is a time to plan how you're going to vote and then vote your plan. Go to vote.org and check what's going on out there, but please be sure that you are a registered voter and you can still do that. I don't know, Billy, I'm going to open it up to you if you can. If you got that poll watcher information. If not, we'll look for it next time. You can just chime in if you have that for us in these next couple of minutes. We do want to ensure that people know that there's going to be some proper attention given to that. We also want to encourage you, and it's been said, if you're going to vote, you might want to just do the absentee ballot, but you might want to just take that ballot in and put it in the box yourself rather than doing it otherwise. Here's another exciting thing that we wanted to have talked about: the community health workers. The webinars are now available for you to get CEUs. I think that Dr. Deborah and the folks at the Michigan State University worked this out for us. So community health workers, if you need the CEUs to continue to get your certifications, this is an opportunity for you. Please email us at info@healthyflint.org for more information about getting CEUs for participation in the webinars. We also want to remind you that every week there's an opportunity for you to complete a pop-up survey. I want to talk about the survey. Join us on Facebook, like us, subscribe to YouTube, and send us this question. I want you to really understand the importance and the value of the responses that we get from you in the pop-up surveys. It helps us to identify people like Superintendent Jones, Dr. Reynolds, the physicians at the hospitals, and all of those that will bring relevant information to you. So please complete that pop-up evaluation for us and help us to respond respond in a way that's meaningful to you. I need to go back and say for today, there is, if you do not have, If you do not have an insurance card, please don't let that keep you away. We will work with you, but we want everyone to show up today. And we also want to encourage you. This has been a great hour for the last 27 weeks, and there's more to come. We invite you to join us next week for our webinar again. More great information will be provided for you. Look forward to hearing from you this week. Information, questions that you might have, so that we can bring relevant information to you about what's happening for our Flint community during this corona pandemic. So thank you for joining us today, the Healthy Flint Research Coordinating Center Flint Community Webinar on Coronavirus. We appreciate all of you that participated in our session today.